Welcome back to the Truth Be Told podcast. My name is Brandy. I am a registered dental hygienist with a local anesthesia permit, and I have been practicing in the dental field for the last 20 years. If you are joining us for the first time, our podcast is focused on providing the underserved and underprivileged communities, particularly communities of color, with the information, the resources, and the tools to improve their dental health care experience. So, you guys, today is going to be all about oral cancer screenings and how you guys should be asking your dental professionals, whether that's your dentist or your hygienist, if they perform oral cancer screenings. And if they are not, you can ask them to perform one. You should get one each time you have your checkup and cleaning. So for most people, that's every 6 months. Some people go every 3 months. So it's definitely something you should ask for. So oral cancer screenings are super important. Most oral cancers present usually in stages 3 and stages 4. And when they present that late, um, the cure rates are extremely low. The interesting thing is that oral cancer is very highly preventable. So, the most primary risk factors for oral cancer are going to be smoking and alcohol use. Um, these two risk factors usually present in about 90% of the cases. So, that is really high. So that's the reason why they say they're preventable, because 90% of the time, the cancer diagnoses are related to alcohol and tobacco. Other risk factors include HPV 16 and HPV 18. These viruses are associated with a greater risk of acquiring cancer of the oral pharynx. According to the National Center for Health and Statistics Supplements survey in 1992, only 14% of patients reported that either their dentist or their dental hygienist had performed the oral cancer screening. So, as I stated before, oral cancer is highly preventable. However, the mortality rate is extremely high, and it's mainly because it's typically caught in later stages. As I also mentioned before, stage 3 and stage 4. At that point, it is really it's highly unlikely to have any cure of the oral cancer. The one way we can definitely combat this is by having effective oral cancer screenings and referrals. So if there's any issue, you'll be referral. So this helps with early diagnosis. When you have early diagnosis, you have an increased outcome for the patient. So the things that we look at during an oral cancer screening are the lymph nodes, which are here under the chin and in the neck, your lips, the inside of the lips, the inside of your cheek, the gingiva or the gum tissue, the top surface and underneath of your tongue, the sides of the tongue, the hard and soft palate, and also the oral pharynx. We also check the thyroid as well. If we do find any suspicious lesions, we refer you to see an oral surgeon. At the oral surgeon, they will do a biopsy of the area, send it off to the lab, and the biopsy will come back either cancerous or benign. So you will know whether or not there are any cancerous cells present after the biopsy is completed. So that's it. I just wanted to give you guys a little bit of information on what an oral cancer screening is. It literally takes 30 seconds. I perform one on each and every patient. It does not take long. So if you guys have any more questions about oral cancer screenings or any of the other videos that we posted in the past or any dental questions whatsoever, please hit us up on our email, truthbetoldpodcast@gmail.com. Also, you can hit us up in the comments of our Instagram at Truth Be Told Podcast or on our YouTube page at Truth Be Told Podcast. Thanks everybody for watching and have a wonderful weekend, and we'll see you soon.